other person for that matter, in English or in Czech. There are headphones. Channel 1 is Polish, Channel 2 is English, Channel 3 is Czech. Szanowni Państwo, powiem tylko w kwestii tłumaczeniowej. Jeśli ktoś by potrzebował tłumaczenia na język polski, to są słuchawki. Na kanale pierwszym język polski, na kanale drugim język angielski, na kanale trzecim język czeski. I'm sorry that I can't say the same thing in Czech. I'll try to improve for the next time. First of all, I would really like to thank our partners, because we're not organizing this on our own as Europa Patient Association. So thanks to FEPS, to David Rinaldi, Foundation for European Progressive Studies, which was absolutely instrumental for making this happen. Thanks to our host here in Cieszyn, to Krytyka Polityczna Świetlica w Cieszynie. Thank you very much for providing us the venue and all the help with organizing that. Thanks to our Czech partner, whom we found also really important in this discussion, to Masarykova demokratická akademie, to Progresivní analytické Centrum, and last but not least, to Centrum imienia Daszyńskiego, who also was very important for making this happen. So let me just say a few brief words why actually we are organizing this conference. And why did we bring politicians and experts and just people engaged in public health matters together? The reason is very simple. It is because we think health is deeply political. First of all, because proper analysis, proper expertise of problems of health really requires understanding the political dynamic. The questions we will be discussing, so privatization, social and regional inequalities in access to health, the burden of long COVID on workers, on the economy, on healthcare system, mental health crisis, these are all issues, problems that have political causes, and something we'll discuss, I think, they also have political effects. And the second reason why we think we really need to think about health politically is that to address these problems, we need political vision and political boldness, political will. I've been using the words like challenges and problems quite a lot, but progressive forces, however we want to define it, because we are a cross-partisan organization working with different political families across the political spectrum. Anyhow, the progressive or pro-social forces have always won and built their strength when they were creating policies that actually brought health for all, to recall the title of our conference again. And just to sum up, if I would to propose a tentative framework for our discussions, I would just say two things. And this is something that we bring from our work in advocacy, on implementation, on other matters, like green transition, for example. So, first thing that I would say is that we should not be defensive. Retreating under the pressure of pseudo-libertarian, social Darwinistic, anti-social political forces on question on health makes us weaker on other questions. Climate, you name it. So access to clean air, to healthy food, to accessible support during pregnancy, etc., are not only questions of our safety or security, they are our fundamental liberties. And we should be bold enough to defend and to define them as such. And the EU, and this is our fundamental belief, will only strengthen its legitimacy only if it is connected in people's minds to actual programs that bring solutions that help them to take care of their health. And secondly, and again, something we bring from our experience working on other matters, it's very hard to convince, for example, a miner to support a green transition. But we see this happen wherever the programs we were facilitating brought decent jobs, brought development to the regions. So we think we just need similar case studies, working case studies in the matter of health, just to show that the local government, with support of national government and the EU, can, for example, provide good air quality in public schools, in public buildings, in workplaces. So just to sum up, we need boldness, we need case studies that show that this could work for people in their places. So I'm really looking forward to these discussions, and without further delay, I will pass it now to David, and I will also, David, let you, if you can, to introduce our esteemed guests, because we will have two very exceptional speakers at our opening panel. So, David, the floor is yours.
Thanks a lot, Mateusz. Please let me thank Mateusz altogether. And with that, not sure it works. Probably yes. I hope it does. And big thanks to all your colleagues as well at the Europa Patient, and as you mentioned, our partners here in Poland, the Daszyński Center, and the Masarykova academy in the Czech Republic, as well as the Progressive Analytical Center led by Petriček, that is here with us. I think it's maybe someone in the... Thank you, super, appreciate it. Daily towards equality and fighting inequalities. It's fantastic to come back to Poland and find somehow a new vibe in this country, where Europe is no longer the enemy, but is something that we can shape together for the benefit of the many. This is, I would say, really refreshing to find a new partner, new big political partner for collaboration, and the presence of Deputy Minister Piechna-Więckiewicz is here to testify that we start from the real needs of the people, including prioritizing at government level mental health, inequality, fighting inequality since the early years. You have seen that the title, besides focusing on health for all, is also an attempt to move from a slogan to reality, to clear policies. And this is what we would like to achieve in engaging with you. Many of you are political actors, engage in youth associations, professional associations, high-level think tanks, political parties. The feeling is not only to have a conference, but is also to underline what are the possibilities that we can have besides this moment of, I would say, almost constant electoral narrative. You just had an elections in Poland. Soon there will be the European elections. But in the European elections, crucially, they mean the new beginning of a legislature in Brussels. And that is the moment in which we have to put in the work program of our common union the things that we wish to see for the next 5 to 10 years. So the issue is a little bit, of course, to tell the good things that have been achieved, or the things that we prioritize, but it is a political and policy work to literally force the European Union to move steps in the right direction. You are all aware that with COVID-19, the European Union experienced a little bit this need to cooperate politically on health. The buying together vaccines was probably a big thing, and there is this feeling that Europe needs to do more on health for everybody. But the tools, we will hear it in a second, the tools in the hands of Europe are still relatively limited. So we need to basically define the space for political cooperation. And unless we are really active as lefty operator, social democrats, socialist, progressive, pro-equality people, or the model that is being defined now in Brussels is a model led by the center-right, in which the idea put forward by the Social Democrats of a European health union might even end up with something on data space for health, which is okay for research, but I think people need a little bit more than cooperation on data only. So that's a very minimum part. And another initiative on fighting cancer together, which is okay, it's nice, but very much focus on treatment only, which is relatively, also, I wouldn't say captured, but in the interest of some pharma. So we have this ambition of delivering high quality for all. It cannot be that Europe is active on these two things only. There has been a move to, to go in the direction of a European strategy on mental health. We are thinking about, internal market, financing, regulating pharma, prices, setting minimum standards. There's a lot to do in order to help national health systems to improve. So today we will look at different aspects: privatization, marketization, mental health, regional and territorial inequalities, perhaps even touching upon this difficult issue we were discussing yesterday of many qualified nurses from Poland, Czech Republic, Hungary, Bulgaria, moving to other countries, living somehow a little bit of difficult solutions for those that live here. So a long list of topics today. We will try, given the setting that is also rather informal, let's maintain it informal. So we will have speeches, and many of you will have your own say. But in a sense, feel free, take the floor, raise your hand, comment, engage a bit, because the issue here is also to confront each other. Most of us are, I would say, specialists of politics or health policies. So it's a moment in which we have to reinforce a common agenda. Yeah. So don't feel shy in this in this setting or informally. Please engage, share, because it's the togetherness that can give us a little bit more power at the European Union level, and that is why we chose also this town. That is, from our viewpoint, a good place to talk about the European Health Union, because if I'm not wrong, it's not even 100 meters, and you are in another country. You are in the Czech Republic. So the feeling of having real European services, European standards. It cannot be the case that you have certain quality here and certain prices here, certain quality there and other prices there. This is something that we should not accept, because people are moving and because we are all human beings requiring decent standards in health, housing, transport, and more. But you're not here to listen to me, so let's stop here and let's go to the real serious intervention, because we want to hear a lot about what are the plans as well of the current Polish government in understanding what are the way to fight these inequalities we've seen during the pandemic, affecting a lot people, from housing and education and health, is always the more vulnerable that were impacted the most. And it is also the more vulnerable that now have big issues with mental health that has become truly a problem for the many, I would say in many households. It's a relevant issue. How do you see the societal problem, perhaps, of the connection between health, inequality, also linking to education, which is your portfolio, and the struggle of the young people. I pass the microphone and the floor to Deputy Minister Paulina Piechna-Więckiewicz.
Thank you, David. Dziękuję bardzo. Będę patrzeć, żeby nie przekroczyć czasu i żeby dla nas wszystkich starczyło czasu. Zacznę od może COVID-u i tego, jaki miał wpływ na polską szkołę, a wpływ miał wielki i to jasno wynika nie tylko na pewno z naszych osobistych opinii, ale również polecam bardzo serdecznie raport Najwyższej Izby Kontroli, który wykazał to, co można było podejrzewać, że działo się i czego konsekwencją jest COVID i brak działań odpowiednich na szczeblu rządowym. Otóż oczywiście COVID i nauczanie w trakcie COVID-u to była rzecz, z którą nie tylko rząd polski musiał mieć do czynienia i musiał reagować. Natomiast środki, które zostały podjęte, były niewystarczające. W konsekwencji dzieci i młodzież po pierwsze nie miały dostępu do dobrego jakości nauczania w równym stopniu, prawda? No bo oczywiście zależało to od podejścia dyrektorów szkół, od pracy nauczycieli. Nie miały w trakcie zdalnego nauczania, bo ten model Polska wybrała i rzeczywiście w Polsce okres zdalnego nauczania trwał relatywnie długo w porównaniu do innych krajów. Więc mieliśmy do czynienia z całym wachlarzem rzeczy, które po prostu musiały się wydarzyć. Wykluczenie cyfrowe, brak dostępu do odpowiedniego sprzętu, mimo prób państwa, co chcę wyraźnie powiedzieć do tego, żeby ten dostęp zapewnić. Niskiej jakości łącze, jeżeli chodzi o internet, bądź w ogóle problem z dostępem do internetu, co musiało się oczywiście przełożyć na to, na dostęp do wiedzy, wyniki również uczniów. Ja pamiętam ponieważ ja mam córki, które w tej chwili mają 12-15 lat, więc wtedy były odpowiednio młodsze, ale pamiętam, jak moje dzieci płakały, kiedy nagle w trakcie testu zrywało po prostu połączenie. I oczywiście jest to obiektywne, tak? To nie jest niczyja wina, natomiast tak po prostu się działo. I to, co wykazuje raport Najwyższej Izby Kontroli, to znaczne pogorszenie kondycji psychofizycznej dzieci i młodzieży, również nauczycieli. Kwestia równości dostępu do odpowiedniego sprzętu musiała mieć też wpływ na to, o czym dzisiaj rozmawiamy, tak? Czyli nierówności zostały jeszcze pogłębione. Te, z którymi mieliśmy do czynienia wcześniej, one zostały pogłębione. Najgorsza chyba sytuacja to sytuacja dzieci, które w pewnym momencie po prostu przestały albo miały utrudniony dostęp do zajęć terapeutycznych, do rewalidacji. Mówimy o dzieciach ze specjalnymi potrzebami edukacyjnymi. Oni i ich rodzice zostali sami po prostu bardzo często z tym problemem, szczególnie w małych miejscowościach, gdzie ten dostęp i tak jest siłą rzeczy w Polsce utrudniony. Wyszliśmy z COVID-u i właściwie jest tyle kwestii, które dzisiaj będą omawiane i o których trzeba byłoby powiedzieć. Od zdrowia psychicznego począwszy na prawie na przykład uznanym rezolucją ONZ-u, czyli powszechnym prawie człowieka do zdrowego, czystego środowiska, bo jak rozumiem, o tym też dzisiaj będziemy rozmawiać. Więc polski rząd ma w tej chwili bardzo wiele wyzwań przed sobą. Ja może zacznę od nierówności, jeżeli chodzi o to, z czym mamy do czynienia, czyli z ujemnym przyrostem naturalnym i ten problem, który już mamy i za chwilę się pojawi. Mamy ujemny przyrost naturalny, tendencja jest jednoznaczna, w związku z czym za chwilę okaże się, że w wielu małych miejscowościach będziemy mieli problem z liczbą uczniów w klasach. Bardzo chcemy, żeby ten problem rozwiązywać nie w sposób najprostszy pewnie dla niektórych, czyli likwidowanie szkół, tylko żeby włączyć małe szkoły, rozszerzyć jakby zakres usług publicznych, które byłyby w tych małych szkołach prowadzone, połączyć usługi i tutaj pożenić dostęp do kultury, który też jest bardzo często utrudniony, dostęp do zajęć dla seniorów, seniorek, to jest też bardzo zaniedbana społeczność w Polsce, żeby te nieruchomości, żeby samorządy miały pieniądze, tak, czyli żeby nie musiały używać argumentu finansowego i żeby można było połączyć różne środowiska, żeby szkoła stała się rzeczywistym centrum życia lokalnego, co działałoby dobrze, jeżeli chodzi o usługi publiczne i życie lokalne per se, ale też finansowo miałoby to po prostu sens. Mówię o tych małych szkołach, bo to jest pytanie, które bardzo często się ostatnio pojawia w kontekście ujemnego przyrostu naturalnego. Poza tym rzeczywiście dla zdrowia psychicznego dzieci i młodzieży to jest bardzo ważne, żeby uzyskiwać wsparcie w swoim lokalnym środowisku. I to jest kluczowe, bo tam jest najbliżej rodzina, tam są przyjaciele, więc likwidacja masowa małych szkół miałaby również duży wpływ na kondycję psychiczną dzieci i młodzieży. No ale co jest z tą nierównością? No nierównością jest też brak psychologa w każdej szkole, tak? My mamy rozpoczętą reformę, która zakładała obecność psychologa w każdej polskiej szkole. W tej chwili ta obecność plasuje się na poziomie 75%, to znaczy w 75% polskich szkół jest psycholog, w 25% psychologa nie ma. I można by powiedzieć, że to i tak 75% to już jest całkiem dużo, ale polskich szkół jest naprawdę dużo. To oznacza, że w 4000 polskich szkół w ogóle nie ma psychologa. To znaczy, że jest 400 ponad gmin w Polsce, w których nie ma psychologa w szkole. Psycholog w każdej szkole to jest kluczowa, podstawowa sprawa do tego, żeby rozwiązać kwestie związane z dobrostanem dzieci i młodzieży. Również dlatego, że po prostu dostęp do psychologa prywatnie, gdyby ktoś chciał się do psychologa udać, to jest bardzo kosztowna wycieczka, bo to jest przynajmniej mniej więcej około 200 zł wzwyż. Pewnie można gdzieś tę usługę znaleźć taniej, ale zazwyczaj jest to większa kwota. Jeżeli dodamy do tego, że terapia dla niektórych dzieci to nie jest kwestia jednej wizyty miesięcznie, prawda, tylko kilku wizyt miesięcznie, to robią się z tego bardzo poważne kwoty. I to, co my robimy i chcemy zrobić, to po pierwsze zapewnić psychologa w każdej szkole, to znaczy dokończyć ten proces, w którym w każdej szkole dostępny jest psycholog. Zainwestować w poradnie psychologiczno-pedagogiczne jako integratora właśnie działającego na rzecz uczniów i rodziców, bo to jest kolejna kwestia. W całym procesie reformowania psychiatrii dzieci i młodzieży gdzieś umyka zaangażowanie rodziców do tego procesu. Bez rodziców zaangażowanych żadna terapia, tutaj są dzisiaj z nami na sali lekarze, po prostu nie pójdzie do przodu, nie będzie dobrych efektów. I dlaczego mówię o tym programie? To jest program dla poradni psychologiczno-pedagogicznych realizowany ze środków FEPS we współpracy ze Szkołą Główną Handlową. On ma uczyć nauczycieli, specjalistów, pracowników poradni psychologiczno-pedagogicznych, jak tym integratorem być, ale jest też 70 milionów złotych w tym programie dla samorządów, dla organów nadzoru na doposażanie poradni psychologiczno-pedagogicznych. Ubiegamy się i będziemy realizować również programy, które będą trochę nowum na w Polsce. Mówię tutaj o wsparciu rówieśniczym, o peer support. Tutaj będziemy się też ubiegać o środki, bo są takie środki w ramach innowacji. Chcemy, żeby młodzież, która i tak jest zaangażowana w pomoc swoim rówieśnikom przy pomocy nauczycieli koordynujących tego rodzaju pomoc, mogła tą pomoc dostarczać w bezpiecznych warunkach. Oczywiście wszystko byłoby zadbane, to jest bardzo istotna rzecz. To, co jest dla mnie osobiście najważniejsze i o co walczyłam w zeszłym roku, to współpraca międzyresortowa. My skierowaliśmy, nie chcę bardzo wkraczać w politykę, ale już tak zakończę takim może optymistycznym akcentem, żeby nie przedłużać, bo na pewno będą jakieś pytania. W marcu, bodajże pod koniec lutego zeszłego roku, skierowaliśmy z grupą posłów takie pismo do premiera Mateusza Morawieckiego, żeby zafunkcjonowała współpraca międzyresortowa. Chodziło o resort wtedy zdrowia, edukacji i polityki pracy, dzisiaj rodziny, pracy i polityki społecznej. Do tej pory nie uzyskałam odpowiedzi. Pan Mateusz Morawiecki już nie jest premierem, natomiast ta współpraca międzyresortowa stała się faktem. Półtora tygodnia temu minister Nowacka, minister Agnieszka Dziemianowicz-Bąk oraz wiceminister zdrowia Wojciech Konieczny symbolicznie zapoczątkowali tą współpracę międzyresortową. I dlaczego ona jest ważna i dlaczego wtedy o nią prosiliśmy? Dlatego, że nie damy rady walczyć o zdrowie psychiczne dzieci i młodzieży, a ten kryzys dosięga co najmniej 10% dzieci i młodzieży w Polsce. To są dane naprawdę, uważam, optymistyczne. Jeżeli nie będziemy mieli współpracy na poziomie różnych służb, od lokalnych samorządów, przez pracowników pomocy społecznej, którzy bardzo często są pierwsi, mogą pierwsi zareagować na kryzys, przez pracowników ochrony zdrowia, pielęgniarki w szkołach, bo to nie chodzi tylko o psychologów, tak? Bo to nie chodzi o to, żeby nauczyciel nagle stał się psychologiem, ale chodzi o to, i w to też chcemy inwestować, żeby nauczyciel już w procesie stawania się nauczycielem, edukowania się, był doposażony, wyposażony w wiedzę. I o tym rozmawiamy z kolei z Ministerstwem Szkolnictwa, Nauki i Szkolnictwa Wyższego w umiejętności reagowania na kryzys. Jak mówić do dzieci i młodzieży, jak reagować na ich potrzeby emocjonalne. I również deklaracja minister Nowackiej, minister Leszczyny o położeniu nacisku na edukację zdrowotną, tak? Na edukację zdrowotną, holistyczną, od naszego mózgu przez nasze ciało. Tak? Chodzi o zdrowie psychiczne, o zdrowie fizyczne, chodzi o to, jak jemy, jak czujemy, żeby to wszystko po prostu miało sens, więc te wszystkie działania, które podejmujemy, środki, które uzyskujemy, współpraca z WHO również, współpraca z UNICEF-em, z którym też mamy program doszkalania 1100 nauczycieli, specjalistów. To jest wiele działań i ostatnia ważna rzecz, bo to nie było zwyczajem poprzedniego rządu. Bardzo szeroko zakrojona, otwarta współpraca z organizacjami pozarządowymi oraz związkami zawodowymi. Ja z pełną odpowiedzialnością mogę powiedzieć, że wrota Ministerstwa Edukacji zostały szeroko otwarte dla NGO-sów, dla związków zawodowych i spotykamy się non-stop, codziennie. I mam taką nadzieję, że te wszystkie działania przynoszą wraz z potężnym budżetem na zdrowie psychiczne dzieci, młodzieży i dorosłych, bo te środki są zagwarantowane w budżecie, przyniosą wreszcie efekty, ale to będzie długa praca, w której musicie nam Państwo pomóc. Dziękuję.
Thanks a lot, Paulina, for giving us a little bit of hope also from the side of a responsible government finally in place. Exactly after this session we will have one on mental health, and I see already plenty of experts on mental health here, so I'm quite sure that some of you would like to fire some questions to the Deputy Minister, but if you don't mind, we have the second intervention as well, and then we collect some questions for them to respond. So, you know, come up with a question, frame it, but hold it for a second, because we are very happy to have here with us today Vytenis Andriukaitis. At the moment, he is the World Health Organization Special Envoy for Europe, but he had a big responsibility in Brussels as European Commissioner for Health and Food Safety, plus a track record of being a leading social democrat in his own country, in Lithuania. Thanks for flying here from Vilnius. And personally, I take this as a commercial break from the Foundation European Progressive Studies with Andriukaitis. Under his leadership, we wrote quite a nice book on European Health Union, a blueprint for generations, with several experts involved, looking at the different aspects of different building blocks of the European Health Union, that I'm sure you will present as now, as well as connected with the discussions that we had just now, looking at a European approach to mental health. Is it necessary? And inside there is also somehow a look at the situation in Poland. Particularly, there's 3 countries surveyed in detail, thanks to Sarah Bojakurz, that is here with us. I hope I didn't destroy your surname. Okay. Sarah, I think it's enough. So that we maintain all publications available here, there, as well as online for free. So there is a lot of material, and now we want to hear something on material, dear Andriukaitis, but also a little bit of passion for constructing this European Health Union together.
Thank you, David. Thank you for previous speakers. It was very important to listen to you and to think about mental health, because mental health is so complex, so difficult, so multi-sectorial, and of course so long-standing issue. We need to understand that mental health will be 10 years as a minimum on the agenda of European Union and on the agenda of every European Union country. Let me start with my presentation, if I may. Yes, okay. If you are not against, I will go. Yes, I don't need my phone. Yes. Why we decided to present this book? Because it was a very good cooperation between our Institute for Sustainable Health and Sustainable Development and European Progressive FEPS, Foundation of European Progressive Studies. And we decided to present something, more comprehensive picture, speaking about concept. What does it mean, European Health Union? Next slide, please. And you see a table of the content. I am very happy that here in the room we have Mihaly Kokeny, one of the authors of this book, and we presented 3 parts of our book. First of all, fundamentals of a European Health Union. Because we all know to have something to discussing, if we are discussing understanding about, we need to have some fundamentals. And second part is main avenues of pan-European cooperation forward. Those avenues are now. Now, you see avenues related to crisis, to pandemic management, crisis preparedness, health technologies, digitalization, and innovations, universal health coverage, rare diseases and cancer, European Cancer Plan, Europe is beating cancer, equal access to healthcare workers and workforce, and also external dimension. But it is not enough. We see now only 5 programs in Europe, proposed from European Commission side, but those programs, are in hands of member states. And if you ask member states how they are dealing with those programs, you can see very complicated picture. And then, of course, our third part is policies of transition towards healthier and more socially inclusive Europe. Next slide, please. When you ask ourselves why health is far from attention in political debates, but the figure shows, if you compare how many employees are working in health sectors, you can see, in agriculture, forestry and fishing, mining and quarrying, manufacturing of basic figure shows down. Health and health sector industry, health industry, is going up. Health economy plays important role in the European Union. But it's far from attention when you are speaking a debate. Please, next slide. Next slide, please. Next slide, please. And if you see public opinion, one prominent issue that concerns Europeans is health. And you see a big gap between political debates and public concern. Big gap. They strongly desire the EU to address public health matters and effectively respond to future health threats through a unified European policy. Recognizing the magnitude of this task, Europeans understand that achieving such a policy would necessitate amending treaties of the EU. Next slide, please. And therefore, we envision the following set of criteria as parameters that would determine the eligible areas of EU actions. One of them, when a member state is overburdened with the issue at hand. And all member states today are overburdened. All. Of course, second, cooperation between different member states on an issue brings added value. Please ask ourselves how Poland is cooperating with Germany, with Lithuania, with Czech Republic, in cross-border area related to all health care issues. What about cooperation in buying some medicine and so on? No one example in reality. All governments are doing on their own. And of course, there are evident consequences to health. And evident consequences we will show. When a health issue causes public distress, pandemic and public distress was very high. Very terrible picture. There is a cross-border nature to health issues at hand, and there is a possible, timely, and socially acceptable action at the EU level to address it. We propose those, those criteria. Next slide, please. And of course, we all know that all member states signed, agreement related to Sustainable Development Goals. And number 3 of Sustainable Development Goals is health and well-being. And such health and well-being is interlinked with all other 17 Sustainable Development Goals. Please look into European Council agendas. When they discuss issues about implementation of Sustainable Development Goals at EU level, please ask ourselves. We are voters, we are citizens. Why Sustainable Development Goals are far from attention? And of course, health as a central, as interconnected issue with all other goals disappeared from political debates. Let's next slide, please. And then a very important issue is coverage dimension. And if we're adding service access, you can find population coverage, service access, cost coverage, and you see how many criteria should be included when we're analyzing, service access to healthcare. But when you are asking member states about their, data, how they can provide data related to access to healthcare, keeping only one aspect, access to primary healthcare, for example. And if you can find, nothing serious, only going through the scientific assessment, you can find some data. But if you look into Eurostat, the health data disappeared. As if better data are a prerequisite to inform policies, the ultimate goal is to fulfill the commitment to ensure access to health care expressed in Principle 16 of the Pillar of Social Rights. Pillar of Social Rights, Principle 16 is access to affordable health care and so on and so on. And what we have now in our real political life, nothing. And enhancing solidarity, equity of health coverage in the EU should be the overarching objective of European Health Union. It is an ongoing challenge requiring strong involvement and coordination of all member states. Let's go to the next slide. And of course, I can show only one example, rare diseases. The name rare diseases is misleading. We have in European Union 32 million people suffering from rare diseases. 32 million. We know that about 7,000 rare diseases. From them, only 1,000 should be treated now because we have a lot of work from scientific point of view. But if you ask access and diagnosis and treatment of people with rare diseases, you can see no one country is capable to deliver treatment to patients with rare diseases. No one. Starting with Germany, finishing with Lithuania. Why? Because lack of capacities, lack of knowledge, lack of financial means, and of course, and so on and so on. Much work has been done to tackle rare diseases, but even greater challenges lie ahead of Europe. Only when patients no longer have to wait for 5 or 6 years to get an accurate diagnosis. Diagnosis odyssey is average about 7-9 years, only speaking about diagnosis. When high-quality, effective, integrated, and coordinated treatments are given to at least 95% of patients, now only 5%. When patients and their families become happy and fully integrated members of our society, only then we will have the right to say that we did not leave no one behind. Our slogan is, leave no one behind. Or what about vulnerables? Underground people and so on. Its slogan is far from reality. Let's go to the next slide. And you can see now also terrible issue with healthcare workforce shortages. Now it is ticking bomb in the EU, and now it's #1, because we see now at this moment we have lack about 3 million doctors of general practitioners, and we have no chance to deliver health care because we have lack of nurses. About 6 million nurses we need now, this time, addressing shortages. Who is speaking about those issues? Not no one. Of course, Commission recognition of the problem in the EU care strategy. I know that you just presented EU care strategy, and explicit mention on territorial gap in the proposed recommendations. Affordable long-term care can be seen as a prudent first step, but we need to say health care workforce shortages in Poland, in Lithuania, everywhere. We see areas with medical deserts where around 20 kilometers they have no fund, nothing. No nurses, no general practice, and no pharmacists. And concentration in big cities and in big territories are, in public services disappeared in many regions. Let's go to the next slide. And of course, speaking about treatable and preventable mortality, because it shows really which gap exists between Eastern and Central European countries in the EU and Western countries. The divide in health status between Western and Eastern parts of the EU is far from being closed. We are now more than 20 years in European Union, but such gap is still there on the ground. All countries with figures below the EU average are from Central and Eastern European countries. Health status improved a little bit, but if you look after pandemic in 2020, an increase of treatable and preventable mortality in comparison to 2011 was recorded in Bulgaria, Poland, and Romania. It was statistics. The reduction of treatable and preventable mortality in Central Eastern European countries to the level of the EU average would save us up to 150,000 lives per year. You need to say that health for all should be one of the main goals of our governments and our councils. Let's go to the next. And of course, compare our budgetary means, Now, we know that now we have 5.3 billion euros. But even after this substantial increase, the budget will not exceed 1% of total annual public health expenditure of the EU member states. So many, so small amount of money now. Please, next slide. And generally speaking, next slide, please. Generally speaking, we are also speaking about European Union budget. Please look. European Union budget is this one. If you compare with all gross national income of all 27 member states, you can understand why we need to speak about our necessity to discuss about European Union future. We are ready to invite Ukraine, Moldova, Georgia, and Western Balkans into EU, having this 1% of European budget? Absolutely impossible. We need to discuss possibilities. How can we, do more addressing issues with very small budget? Let's go to the next slide. And of course, European treaties. European treaties are very weak on health. Health is not in the preamble. Health is not in the Article 3. Treaty on the Functioning of the EU is prioritizing articles to devote it to the development of internal market against the articles dealing with other activities of the European Union. Development of health is considered necessary to the Union insofar as it serves better functioning of internal market, not as health is not an aim. It is only a palliative measure. Current health union-related initiatives are not tackling about health as specific objective of the EU. The talk is about a well-functioning internal market generally. And those proposals were based also not on Article 168, on Article 114 and other articles, because they allow the Commission to propose some measures. Legal, fiscal, political limits of stronger health policy enshrined in the treaties do not allow EU to act in a more effective way. Next slide. Pan-European cooperation can create added value in pan-European goods in health. Now we are proposing a concept, public goods. European citizenship and public goods. Local public goods, national public goods, and European public goods. And public goods in health are so clear example why we need to push forward idea about European Health Union as social and health well-being union, which should include public goods into European policies. Most actions in health require involvement of governance at national level. The EU should take decisions and action when the objective on action cannot be sufficiently achieved by the member states, but can be better achieved at EU level. Member states and the EU have stakes in development of European and global public goods, and of course, shared competences. And we need shared competencies speaking about pandemic issues. We need shared competencies speaking about the treatment of rare diseases, treatment of complicated cancers, treatment of multimorbidity and so on. It is not. It is, for me, it's evident. Next slide. And we propose in our book 3 scenarios, and we are asking now you all to advocate those 3 scenarios. We need to do more using instruments which we have. Is scenario A, measures to make progress in health concentrate on what can be done with existing legal, financial, and managerial instruments, upgrading already functioning institutions and improving implementation of already agreed policies, especially keeping in mind those 5 programs. Second, the development of secondary legislation and establishment of new institutions that are supposed to create added value in parallel to fine-tuning of existing instruments of health policy. And those scenario A and scenario B do not require treaty changes. It's required only to activate our efforts to keep health high on the political agenda. But scenario C requires treaty changes. Next slide, please. And moving forward with European health, with genuine European Health Union, we need to enshrine health into preamble of Lisbon Treaty. We need to stress and enshrine in Article 3 sentence, each shall promote universal health coverage by establishing a health union, and we need to include and to rewrite Article 168 of Treaty on the Functioning of the EU. And finally, final sentences, next slide. But first and foremost, the momentum and the sense of urgency must not be lost. It is critical that our efforts to promote a strong European Union should be strengthened in front of the June 2024 European elections and will mark the start of our activities to include the European Health Union concept into a new mandate of the European Union institutions. We would do well to remember that in this difficult time, the EU is one of the few global actors committed to democracy, human rights, rule of law, multilateralism, and health is fundamental human rights, and we need to act, and we need to be very strong advocates proposing genuine, strong European Health Union. Thank you.
Thank you, Mr. Andriukaitis, and thanks to the operators here in the room for capturing the dynamic movement that we had, so that also the people online could follow this passionate intervention, basically almost a complete agenda on how to put health as a priority. It's now the moment, even if we are a bit late, to get some of your inputs. I'll pass you the microphone for your comments and questions. Perhaps you can come here, so also online they see.
Yeah. So good morning. My name is Mihai Kökény. I came from Hungary, and I have some political experience and working with WHO and EU as well, and I am very glad being here as well. So it's very hard to say anything after such a fantastic introductory comments and with the visionary statements by my friend Vytenis. However, I would like to raise just one issue for your kind consideration. The comments from Paulina Piechna-Więckiewicz, I hope it was right enough. I can't say too much in Poland. Your comments should remind us that health is not only the responsibility of one dedicated ministry. And I would hardly imagine any other sectoral policies without a health impact. Think about agriculture, think about education, think about transport or whatever. So therefore, health, I think, should appear as a whole of governance mission, demanding coordinated efforts from the complete governance infrastructure. And WHO is advertising this for a very long time. But what about the European Union? We had a Finnish EU presidency in 2006, which tried to represent the so-called health in all policies approach, but there were not a real continuation in the subsequent rotating presidencies of this approach. Maybe, and I would like to join Vytenis, time has come to recall the health aspects of all other policies, whether it is about the antibiotic use in agriculture or the health consequences of climate change, to incorporate, that type of spirit, that type of thinking when we try to push health higher on the political agenda. This conference is called Health for All. So maybe there should be a next conference, Health in All Policies. Thank you.
We like very much the suggestions. Other questions or comments? Please.
Ja sobie pozwolę mówić po polsku, jeśli mogę. Dziękuję bardzo. Jerzy Przystajko, Partia Razem. Z dużym zainteresowaniem słuchałem tej emocjonalnej przemowy i aspekt, który myślę, że warto poruszyć tutaj, to jest brak profesjonalistów ochrony zdrowia. Ja z zawodu jestem farmaceutą, także znam też od podszewki polskiej, ale myślę, że warto by wybrzmiało to, że systemy ochrony zdrowia w całej Unii Europejskiej powstawały i pewne założenia też o podziale pracy między zawodami, co robi lekarz, co robi pielęgniarka, co robi farmaceuta, to wszystko kształtowało się jeszcze w czasach feudalnych. To jak to widzimy, jeszcze w tym wyobrażeniu, co robią mężczyźni, co robią kobiety, jak wygląda ta rola dobrego cesarza, którego łaska gdzieś tam spływa w dół. I trochę mi brakuje w tej dyskusji wykorzystania potencjału, jaki drzemie w zawodach, nazwijmy to zawodach nielekarskich. Bo tutaj dochodzimy do takiego punktu, cały czas rozwijamy taki brak, gdzie być może moglibyśmy zacząć czerpać nawet z doświadczeń krajów afrykańskich. Tam niedobór personelu jest tak ekstremalny, że to przenoszenie zadań, ta zmiana podziału pracy, zmiana podziału władzy nad procesami w systemie ochrony zdrowia, ona przybiera też ekstremalne formy, bo jeżeli w kraju po prostu nie ma w ogóle lekarzy i pielęgniarek, no to szuka się różnych rozwiązań, które pozwalają chociaż część procedur wykonywać na przykład przeszkolonym, no może to jest złe słowo, ale laikom. W Europie mamy wielką różnorodność tego przenoszenia zadań, task shiftingu. Komisja Europejska też dostrzega ten problem, chociaż wypowiada się tutaj bardzo delikatnie, bo to wywołuje emocje, bo to nie jest tylko rozmowa o takim merytorycznym przenoszeniu zadań, jak to robić efektywniej, bo gdzieś ustaliły się te podziały zadań, podziały pracy i porusza się to taką bezwładnością, że zawsze tak to robiliśmy i może powinniśmy robić to nadal, ale to przemyślenie, odblokowanie tego potencjału myślę, że jest pewną odpowiedzią na to, jakie mamy braki personelu w Europie i myślę, że włączenie tego do unijnej polityki jako pewnego obszaru i później zharmonizowanie tego wśród krajów Unii Europejskiej byłoby wielką, wielką wartością. Dziękuję bardzo.
Thank you. If there are no other pressing questions, you have basically we give you 1.5 minutes each, if possible, to try to respond to these two inputs on labor shortages and maybe the integration of health services within the government.
Właściwie trudno jest mi nie zgodzić się z przedmówcami, więc mogę tylko skomentować, że popieram, więc jeżeli mogę wykorzystać tę minutę na dodanie jeszcze kilku kwestii do polskiej szkoły, to chciałabym wspomnieć o jeszcze jednym ministerstwie, bo to jest bardzo ważne wyzwanie dla nas wszystkich. To jest Ministerstwo Cyfryzacji, którym zarządza wicepremier Krzysztof Gawkowski. Chodzi o higienę cyfrową i chodzi o to, po pierwsze o zdrowie psychiczne dzieci i młodzieży w necie, a po drugie chodzi o bezpieczeństwo dzieci i młodzieży w necie, więc to jest bardzo ważna rzecz, o której chciałam powiedzieć. Druga ważna rzecz, o której chciałam powiedzieć, to zwrócenie uwagi bardzo mocno na przemoc rówieśniczą, na to, co dzieje się w szkołach, bo ja mam te doświadczenia, że dzieci z oddziałów dziennych przyszpitalnych i dzieci z oddziałów stacjonarnych przyszpitalnych często są ofiarami właśnie przemocy rówieśniczej, trafiają na oddział, a potem wracają do szkół, w których ten problem nie jest rozwiązany. I z tym również chcemy bardzo mocno walczyć, żeby wiecie, oddziały stacjonarne są bardzo potrzebne do diagnozy, ale nie mogą być safe space'em dla dzieci uciekających przed przemocą rówieśniczą, tak? I to jest druga sprawa. A trzecia sprawa, wątek wypalenia zawodowego pracowników wielu zawodów ochrony zdrowia na pewno, ale w oświacie również. To znaczy polscy nauczyciele są wypaleni zawodowo, nie są w stanie pomóc sobie bardzo często, tym bardziej nie są w stanie pomóc dzieciom i młodzieży, którymi się opiekują. I to jest trzeci temat i to jest bardzo ważna rzecz, o której mówimy w ministerstwie, którą chcemy się zająć. I czwarta, najważniejsza. Oświata to nie tylko edukacja. Oświata to również wychowanie, to wspieranie rodziców w procesie wychowawczym, rodziców, którym nie zawsze starczy, sami o tym mówią, kompetencji rodzicielskich, musimy im pomagać i ich wspierać, to również profilaktyka zdrowia i stąd ta edukacja zdrowotna, o której mówiłam. Więc ponieważ zgadzałam się z moimi przedmówcami i ich uwagami, to pozwoliłam sobie tylko dodać parę wątków. Dziękuję bardzo.
Thank you so much. I fully agree with you and with your intervention. And of course, we are here like-minded from my point of view. And speaking about possibilities to integrate all sectors, starting with pharmacists, finishing with technicians. We need to understand now we need to use much proper integrated way our resources in front of shortages. And of course pharmacists can play enormous role in providing primary care, for example, vaccination and different issues. Pharmacists can do a lot in areas where the general practitioners do not exist. And we need to use such resources in very integrated manner for sure. And of course also, once again, now as never is important to understand multi-sectorial management of health services. Patient should be in the center, but teams around the patient should be built as team building, including pharmacists, general practitioners, specialized medicine, all team building. We need to understand that now team building approach is a main goal to provide much more effective access to healthcare and of course, but we need to keep in mind that today when we are speaking about health, we need to understand that we are speaking about many issues related to European Union future. And in the treaties, you can what is lacking in the treaties? Health and well-being pillar. Social pillar is not as an aim of European Union. It's only ancillary issue. And we need now to start discussions about treaty changes. And I am very happy to have such book, EU treaties, why they need targeted changes. Is excellent policy paper in proposing new approach based on European public goods, European citizenship and democracy. I ask you to draw attention about this very excellent paper because it covers all topics, including new stage of development of the EU as health and well-being EU. And it is main message from my side.
Thanks. I think it's difficult to galvanize the population on treaty change, but it's good to keep it alive before as a topic before the European election. With a little bit of delay, I'm very happy to pass the floor to Monica Elak for the moderation of the next session on mental health, and I would like to thank Konrad Golota that just reached us from the cabinet. He's head of cabinet of the Deputy Prime Minister and also in charge of digital policies so that we continue really this conversation to see how health is an integrated issue. And thanks to the new Polish government to approach it in this manner. Monica, you have the floor.